Good afternoon. Thank you for joining us. Our webinar will begin shortly in just a moment. We're waiting for a few more people to log on and we'll get started within a moment or two. Thank you so much. Okay, we're going to go ahead and get started. We're going to begin this webinar with just a quick video to get everybody plugged in and in the mood. So let me go ahead and get that started and then I'll resume after that. Okay, great. Hope you enjoyed that little intro. Gives a few visuals as to what we're going to be talking about today. And so let me get this program started. First of all, my name is Stephanie, and I'll introduce myself a little bit more in just a moment. Today's topic is the CoolPeel, which is a state-of-the-art, brand new technology in the area of aesthetic lasers that we're very excited to be talking with you about today. It is the latest in CO2 laser resurfacing. And we'll get into what that means more in the coming slides. So this is me. I am Stephanie Schlageter. I'm the founder of Radiance Med Spa. And we've been in business since 2006. So we have, we're in our 15th year of business right now. And have had a long history of aesthetic laser services. So we'll talk about that as well as we work through the presentation. But we're very excited to add the CoolPeel to our already very comprehensive line of aesthetic lasers. A few informational tidbits about Radiance. As I just said, we were founded in 2006. For those of you who have not been to Radiance before, our staff consists of a group of very experienced trained medical professionals, including our physician, Dr. Francis, as well as a team of nurse practitioners, medical estheticians, and medical assistants who perform all of our treatments. Our specialty is non-surgical cosmetic procedures, and our mission is to help people feel great inside and out. And we feel very fortunate to be in this business. It's a lot of fun, and we make a lot of people really happy. So we have more than 14 years of experience with aesthetic lasers. That's a really important thing for you to know and to look for in a provider. Lasers are very common in the aesthetic industry. They also come with some of the greater risks. And so you really want to make sure that the person operating a laser on your skin really, really knows what they're doing. When things go bad with lasers, things like scars and pigmentation and permanent issues can occur. So you really just, the importance of experience cannot be overstated. All of our nurse practitioners are laser certified, which just by the way, is not a requirement in the state of Florida. However, Radiance holds the bar very high for the quality of our outcomes as well as our patient safety. So we require laser certifications for all of our nurse practitioners, even though it's not a regulatory or legal requirement put upon us by the state anyway, either way. So they are certified. We, in the more than 14 years of business that we've been doing aesthetic laser treatments, have performed literally tens of thousands of laser treatments. So again, lots of experience. And each of our nurse practitioners has more than a decade of experience performing laser treatments. So bottom line, you are in really, really good hands when you come to Radiance Med Spa for laser treatments. This is just a quick slide on Dr. Francis, who is pictured on the left. She's our medical director, and myself on the right. Just a little bit more about us. Dr. Francis has practiced medicine in the Clearwater area for more than 20 years. When she's not at Radiance, she's at Morton Plant Hospital on the team of emergency medicine physicians there. She's been our medical director since 2007, and she's board certified in both cosmetic and emergency medicine. I have a master's degree in biomedical engineering and more than 24 years of experience in the medical field. Prior to founding Radiance, I worked for a medical device company and served many roles, including research and development, product design, did a lot of clinical work in the field in operating rooms all over the place, and also had a lot of business experience there. So together, Dr. Francis and I oversee the operations at Radiance Med Spa, which, as I said earlier, was founded in 2006 as a startup business, which, by the way, also puts us as one of the earliest med spas, not only in the area, but in the nation, having been founded, almost 15 years ago. So we've got a lot of experience in the industry as well. Quickly to list our nurse practitioners, we have 3 wonderful nurse practitioners, Donna Gosine, Joanne Nuttall, and Julie Keating, all of whom, as I said earlier, have a great deal of experience in the medical field and in the aesthetic industry. They are all trained and certified in aesthetic lasers, as well as Botox, fillers, and cool sculpting. And each has more than a decade, really several of them have more than 12 years of experience in the industry. So just to give you a little bit more information on the individuals within our practice who perform the laser treatments. So without further ado, let's get into the subject matter at hand. In summary, these are the conditions essentially that we treat at Radiance. When a patient walks in our door wanting to look younger and feel younger and look their best, these are really, to categorize it, these are the things that we address with the wide range of treatments that we offer. So we treat lines and wrinkles, we treat skin laxity, which is treating loose skin essentially. Anybody who complains about the texture of their skin not being as smooth or firm as they would like it to be, we have several treatments for that. And we also treat skin tone and discoloration. In addition, we do a lot of feature enhancement and contouring these days, adding volume to lips, adding a little volume or contour to the cheeks, and even contouring jawline, the jawline on individuals. So just to give you kind of an overview, this is what we do big picture at Radiance. And today's presentation pretty much focuses on the first 3. We're going to really talk about fine lines and wrinkles, etched lines in the skin that have come with time. We're going to talk about loose skin, and we're going to talk about smoothing the texture of the skin. And you will hear me talk a lot today about combination therapies. This is a really, really big deal in our industry these days, the use of combinations of therapies to get patients the very best result. It is that age-old equation that the sum of the parts is much greater than the individual items. So when we combine therapies in our industry, we get by far the best results rather than doing these things alone. So we'll talk about that. I like this quote. It's not like a famous quote or anything. It just pretty much speaks to what a lot of people think about when they look at their skin as we age, is just the wish that we could start over and take better care of our skin. Many people share the common feeling that they could have probably taken better care of their skin when they were younger, maybe too much sunbathing, not enough sun protection, not the use of the best skincare products, and so forth. And the really amazing thing about the products the services that we're gonna talk about today it literally allows you to start over with a fresh new palette. And then you can really take better care of your skin going forward. So these are really amazing rejuvenative treatments that give you a fresh start. So I'm going to show you a few pictures of things that we're going to talk about treating today, and maybe you can identify with some of the pictures you're going to see. If you do, then these treatments are for you. So this picture shows the loss of elasticity and some lines and wrinkles around the eyes and under the eyes. A lot of people start to see these, we call these fine lines or crepiness to the skin. This is exactly the topic of the day today, is the texture and the surface of the skin. Here's another great picture. So she's got a little bit of a ruddy complexion, probably just from sun exposure. So this is sun damage. She's got some deep creases and lines around her mouth. And she's even got some laxity here. So some loose skin along the jawline and the neck. All of these things we're going to talk about here today. Here's a picture of a gal who has a little bit of the loss of laxity, or the loss of tightness or laxity around her chin and jawline. She's also got some etched lines around her mouth and a little bit of sun damage and ruddy complexion. She's got these brown spots. So kind of an assortment of things. Again, all these things we're going to cover solutions for in the coming slides. Sorry about the quality of this image, but I just really love it because it shows kind of, it really emphasizes the need for combination therapies. She's got loose skin on her neck. She's got etched lines and wrinkles around her mouth. There are services we're not going to talk about today, but that come to mind with some of these pictures as well, like fillers. This particular patient would also benefit from some volume in her cheeks to kind of lift and tighten the face, but she certainly would benefit from everything we're going to talk about today in terms of resurfacing her skin and tightening things up. This is a great picture of a person with textural issues. So she's really got a combination of what we call superficial texture, large pores. She's got this crepey, we call fine lines or crepey skin. And she's also got these deep etched lines. These can be really hard to treat unless you have some of these technologies we're going to talk about today. A lot of people who are familiar with fillers like Juvederm want to go into these lines and fill them because it seems like that would be just a great thing to fill. But what happens if you try to fill these with filler is you end up looking too bulky in this area, and it can really look unnatural. The best treatment for these sorts of conditions is to regenerate new collagen and new elastin and fill in these lines with the body's own skin. So those are some great examples of what we're talking about today, and specifically the CoolPeel Laser. So what is CoolPeel exactly? Well, some of you may be familiar with CO2 lasers. This is a type of laser that's been around for quite some time. A CoolPeel laser, it's essentially a brand new CO2 laser that the engineers who designed it figured out a way to turn the energy down so that it doesn't have to have a lot of downtime or be as aggressive as an old-fashioned traditional CO2 laser. So essentially, it is a brand new way to safely and comfortably resurface the skin without the traditional downtime, and I should have added risks, of traditional resurfacing lasers. It only targets the superficial layers of the skin, so that stuff we just looked at on the surface, that's what it targets, and it's almost like an eraser. I mean, it literally removes the damage on the surface and the skin grows back with new skin. The reason it can do this, what's new about the CoolPeel, is that it offers precision laser energy. Lasers in the past were much more aggressive without a lot of control or precision. So when you turned them on and applied them to the skin, they would just ablate or vaporize the skin in a very aggressive way. We can now turn the energy down to get the same results, but with much less downtime. The only trade-off we have now is that instead of doing it in one aggressive treatment in the past, we now do a series of treatments. But these treatments will remove the old skin to reveal and regenerate younger, that's supposed to say and healthier looking skin. And these are the things that we treat with the CoolPeel. We treat sun damage, fine lines and wrinkles, rough texture, large pores, pretty much any kind of scars, whether they're acne scars, surgical scars, or scars from injury. Literally, I mean, just about anything you don't like about the surface of your skin can be treated with this technology. Okay, sorry, I'm trying to get this to respond to me. Here we go. I showed this picture because these people on the right, this is the downtime that used to be required if you wanted to get a CO2 treatment done to your skin. And it was a pretty tough thing to go through. You would look like this for weeks, potentially. No sun for a very long time. You would sometimes have oozing. There was a lot of risk of infection. You had to miss work for a long period of time. I mean, these were very difficult procedures for a lot of people to go through, and they came with a lot of risks and unfortunate scarring and side effects. So over the years, these treatments have been available, but not a lot of people have wanted to go through the difficulty of having these treatments done. So they only appealed to like a small slice of the population. And here's a little bit of a history. So these ablative procedures actually first came out in 1991, and they were referred to, ablative literally means to vaporize. So when you apply an ablative laser to the skin, it just burns it off, and then you have to heal back with new skin. Non-ablative means the heat of the laser travels into the skin and causes damage, but it does not burn the skin. It just delivers heat through the skin. Big difference. And those lasers came out in 1996. By the way, at Radiance, we have had all of these lasers except the first one. We've never actually done the full resurfacing ablative CO2 treatments because, to be perfectly honest, few, if any, of our patients would ever want that sort of treatment done. People come to us for comfortable, minimal downtime treatments, and that's really what we specialize in. So we have done and still do non-ablative resurfacing treatments. Some of you may have heard of Fraxel. That's an example of a non-ablative fractional resurfacing treatment. We have a treatment called Eraser now in-house. We've been doing it for years. We used to do Fraxel, but we replaced it with Eraser. That is a non-ablative fractional treatment. And I just want to mention to you quickly what fractional means. Fractional means that instead of treating the entire solid surface at once of your face or body part, we use a laser that delivers little dots of energy, and that's referred to as fractional. And the reason we do fractional treatments is that it offers really great results with less downtime and less risk of problems like scarring or infection. The healing is much faster and the downtime is much easier to tolerate. So there are non-ablative fractional treatments, and now, more recently, there are ablative fractional treatments, and the newest CoolPeel is variable controlled ablative fractional resurfacing treatments. How's that for a mouthful? So sorry to get so technical here, but it's really important, we think, that our patients are educated and understand the differences between all these devices out there, because it can be so confusing. And the most important thing to take away from this slide is that we now, in our possession, have access to a variable controlled, which means we can really precisely control the amount of energy being delivered. Ablative, which gives great results because ablative lasers do ablate the tissue and you get full remodeling, like full replacement of the tissue, which is a great thing to do. But the newer lasers now are also fractional, so you only get dots at a time. So the combination of these things now available to us, came available in 2019, offers ablative-like results, like these amazing dramatic results that you could only get previously with these massive downtime lasers, but you can now get them with great safety, minimal downtime, and minimal discomfort. So I hope that wasn't too much information to tell you all that, but it's just so important and actually so exciting how far lasers have come and the devices that we have available today. This slide is just a little visual. It shows ablative resurfacing. The old lasers from years ago just would blast through the surface of the skin and you'd have this open wound. Then came non-ablative, where the skin is not open, but it just delivers heat. Those deliver good results, but not as good as when you ablate the skin completely. And now we have these little channels of ablated tissue, which both go deeper and are done fractionally. So just a little bit of visual for you. So this is a picture of the actual laser device itself. And this is a quick summary of what the CoolPeel treatment kind of feels like and looks like. It's all about your comfort, honestly, especially in consideration of the fact that historically these treatments were really difficult to have done. This treatment, because of its fractional nature and because of its variable nature, we can make it extremely comfortable while getting you amazing results. We do numb patients for an hour before the treatment. The treatment itself is usually less than 30 minutes, the actual use of the laser, depending on, you know, the size of the area we're treating. We can treat lots of areas, and we'll talk about that: face, neck, chest. We can treat hands. Typically, our patients tell us that it feels warm and prickly during the treatment. You don't really feel a lot of it because you're pretty numb. And afterwards, there's minimal to no visible sign of treatment. And I'm going to show you some pictures in a moment of what it looks like immediately post-treatment. We always perform these treatments in a series of 3 because they're fractional. So we're only doing little dots of damage each time, which means you have to really get 3 treatments to get the full result. And we frequently combine CoolPeel treatments with another treatment that we offer called Vivace. It's a microneedling treatment that goes deeper. And a lot of those pictures I showed you a moment ago have a combination of superficial conditions like fine lines and crepey skin on the surface, but also deep etched lines and skin tightening that we often need to add Vivace to accomplish. So I'm going to step aside here from CoolPeel just to talk briefly about Vivace, which is another treatment that we offer. And I'm only doing this because we so frequently combine the 2 together. So Vivace, just to let you know what that is, it's a microneedling treatment that sends radio frequency energy, which really equates to heat, through the needles and deep into the skin. And that heat causes damage to the collagen and elastin deep in the dermis of your skin, which causes deep regeneration of collagen and elastin and really helps to solve deeper conditions like deep etched lines and wrinkles, as well as it tightens up the skin in the area that we treat. So Vivace is best for anybody who needs skin tightening or who has deeper lines and scars, sagging jowls, or loose skin on the neck. So these are the reasons that we often add Vivace to CoolPeel, because many of the patients that come to us interested in laser resurfacing really are looking for these things too. And we know that we're going to get you the best result when we combine the CoolPeel with Vivace. And I'll show you lots of pictures. This is just an up close of the handpiece for Vivace. It's got these little tiny microneedles that penetrate into the skin. And the moment at which they are penetrated to the full depth into the dermis, a little burst of radio frequency energy is sent through them to heat up the deep dermis. That's the way it works. And so in summary of these 2 treatments, when we have superficial conditions, like stuff that's really up here on the surface, fine lines, texture, large pores, crepey skin, the stuff on the surface, we really like to treat with CoolPeel. Anything that's deep, as I already said, like skin tightening is a deeper condition, deep etched lines, like I showed you some pictures of before. We really need to treat deep conditions with deep solutions. So that's kind of how we look at it for determining the right treatment plan for our patients. So with that in mind, I just think in summary, let's just look at these together. So this patient, upper left, has definitely a combination of crepey, fine little etched lines. And she's also got some deeper lines. Like this is a deeper line. These lip lines are pretty deep. These horizontal lip lines are pretty deep. If we were to just do CoolPeel on this person, they would definitely see some improvement, but it's going to be hard to make those deep lines completely go away without going deeper into the skin. So In this particular patient in the upper left, we would recommend a combination of CoolPeel and Vivace. And I'll talk about this more in a moment, but we do the two treatments the same day. We do Vivace first, and then we do CoolPeel right on top of it. And you do a series of those over time, and it produces beautiful results. A patient like this one in the upper right also has some pretty deep, like this line here, the deep etched lines like this. They will definitely soften with CoolPeel, but they will probably not be gone completely. And I'll show you some before and after pictures at the end of this presentation, so you'll get the idea by the time we end this. This patient would be great for just a CoolPeel and some Botox, by the way, and we do combinations of that as well. But to really eliminate these etched lines and this crepiness under the eyes, this would be a great candidate for CoolPeel. This patient would be a great candidate for CoolPeel because we're just really talking about lots of fine lines and texture under the eyes. And this patient too would probably be a really good CoolPeel candidate. She does have a couple of deep lines here around the mouth. So if she really wanted those to go away, we'd probably want to throw in some Vivace. By the way, this patient in the upper left, I didn't mention her neck. Vivace would definitely be the go-to treatment for her neck. Vivace is just an amazing neck tightening treatment. And by the way, because a lot of people don't know this, and I just like to educate as much as possible, this patient also, I lost my cursor here, sorry, hold on a second, whoops. She would also, the upper left, be a good candidate for Botox in the platysmal bands. For those of you who are familiar with or fans of Botox, a lot of people don't know you can get rid of these bands on the neck with the injection of Botox, but we're not going to talk any more about that today. That's a different seminar, but I do like to mention that because a lot of people do not know that if your neck tends to have these bands, that they virtually disappear with just a little bit of a Botox injection. So this slide is only meant to educate you that darker skin types, we have to be very careful when doing laser treatments. So we use a well-known skin typing system in the aesthetic and dermatologic industry called the Fitzpatrick skin typing system. It was developed by a Dr. Fitzpatrick in the 70s who saw the need to like really categorize patients for laser treatments to keep things safe. But the bottom line is darker skin types, which is a little counterintuitive to some people. A lot of people are surprised to find that darker skin types are more prone to burns and problems with lasers, but they are. Lighter skin types are very, very safe for laser treatments. So pretty much our rule of thumb is skin types 1, 2s, and 3s can get anything done. Laser treatments are not a concern. When you get into 4s, we have to be a little more conservative, but we can still treat. And 5s and 6s, we sometimes cannot do everything we would like to do with lasers. However, the CoolPeel is a very unique type of laser in that it is, we call it kind of a colorblind laser. It's a much safer laser to use on all skin types, and Vivace can be used on all skin types as well. So I only show this so that if any of you in the audience today are a darker skin type, that we may need to have a little bit of a special conversation with you if you're interested in these treatments, just to make sure we keep things safe. Like we often pre-treat darker skin types with pigment suppressors, and we do some things before the treatment to just make sure you have a great outcome. So couple more things. All of these treatments that we're talking about today are accompanied automatically with the topical application of what is called PRFM. Some of you may have heard of PRP. PRFM is basically a more advanced form of PRP. We automatically add this to your treatment because it brings about the very best results. And what is this PRFM? It is your body's own plasma, basically. So we take a blood draw when you come in, thus the little picture over here on the right. We spin it in a centrifuge, and then we extract off the top of what's left. This is the plasma part of your blood, and it contains very high concentrations of your own growth factors and cytokines. And we use that plasma portion as a topical treatment after you get your CoolPeel and or Vivace. So through all those little dots of damage that we cause with the laser or Vivace, your body will absorb this plasma of your own, and you get this really high concentration treatment of growth factors and cytokines, which boost the growth of new collagen and elastin, promote healthy immune response and healing, and really help minimize any redness and swelling post-treatment. It's like a little miracle topical treatment. And because it's your own growth factors and cytokines, it is extremely effective at getting your body what it needs post-treatment. So I just like to mention this because a lot of practices in the industry will charge a lot of extra money for this. We think it's so important for ensuring the best results that we include it as part of every package with both CoolPeel and Vivace. Next thing, really, really important about these treatments is to treat your skin at home with the very best quality and the right products. So we also include the proper kit of medical grade skincare products with the packages for CoolPeel treatments as well as Vivace. Just wanted to mention that. We don't need to go through every detail of the slide here, but we just can't stress enough to our patients that if you're going to invest in your skin by doing a CoolPeel series, you absolutely should put a high priority on treating your skin at home with the best quality products to ensure that you heal safely and correctly and you get the best possible results. So we include a kit of the right skincare products with all of our laser packages. So treatment day, what does treatment day look like? And then I'm going to show you a quick video and a bunch of pictures. We're almost done with the words on the slides. We topically numb you, as I said earlier, for about an hour. The treatment takes, the last slide said about 30 minutes. It can take about an hour. It's really variable depending on the areas you get done. Like some people just get their face done. Some people just get CoolPeel. A lot of our patients get CoolPeel and Vivace, which takes just a little bit longer, but still not that long. Some patients treat their face, their neck, and their chest. So the treatment time is a little bit variable, but the message here is that it's really very quick and easy. When we do combinations, we do the Vivace first, and then we do a CoolPeel on top. With both treatments, it's just warm and prickly at the most, because we do numb you. And then afterwards, you can expect to feel a warm, tight, sunburned feeling. And you should also expect to look like you have a little bit of a sunburn afterwards. And I'll show you some pictures here just a second. And some people swell a little bit. I mean, some people don't swell at all, but when we do see swelling, it's very mild and it can last maybe 1 to 3 days at the most. It's very, very tolerable post-treatment. So here's an example of somebody literally right after getting the treatment. And it looks exactly like this, whether it's just the CoolPeel or CoolPeel plus Vivace. And this usually lasts maybe for the rest of the day in a patient like this, or can persist for maybe up to 3 days, depending on the individual, but really not anything major. Recall the pictures I showed at the beginning of the oozing, really kind of almost bloody looking treatments. So this is such a dramatic improvement. And it's amazing that you can get the same or better results without having to go through that now. Again, another immediately post-treatment picture. So this is what you can expect to look like after the treatment. Just a sunburned, red appearance, very, very tolerable. So this is a patient in more steps. This is before, this is immediately after. She just looks a little bit red. This is 24 hours after. So sometimes we call this bronzing, and you can even see a little bit of mottled complexion. This is the skin kind of, I don't want to call it a scab because it's not really a scab, but the skin does get rough as it heals, and it can take on kind of a bronzed appearance. Kind of looks like you got a tan, like a combination of a sunburn and a tan. And then within a few days, it really lightens up. So again, up to 3 days, you can expect your skin to go through a few mild changes, but it's really, I just can't stress the word mild enough. Here's another one, pre-treatment, immediately after, 24 hours after, she's just a little pink. And then 7 days after, she looks like she's back to normal. But what's still taking place, don't be fooled, she is not looking at her results yet. She is still getting a lot of dermal healing, and change will take place in her skin for the next weeks to months till she gets her final results. So this should be a video. Let me click on this. This is a picture of a treatment being done. We're not going to watch the whole video, but I just wanted to give you a visual of, this is obviously somebody's chest being treated, and just shows you she's changing the shape so she can get into every little nook and cranny. She's targeting specific spots. This was actually after she had treated a good part of the chest, and she's doing a little bit of cleanup, just so you know, because normally she would do the treat across the entire chest and then go back and clean up. So that was just a couple of little cleanup touch-ups, but I just like to show how it's just a little zapping of the skin, just like that. That's it. So that can be done on any part of the body that we mentioned, and usually just takes a few minutes to cover the area. Of course, larger areas like the chest are going to take a little bit longer. And this is a still photo, but I like this one because it actually shows the little dots. So the dots are not uniform here because if you were watching it live, it sprinkles, it kind of like does this little scatter of the dots in that little square area. So each pulse does this little spray scattering of little dots of damage. But I love this picture because it captured the little dots visually. So you can see the laser is actually drilling. I'm going to use the term drilling. It's not like a physical drilling, obviously, but it's literally creating a little channel of damage with that energy everywhere you see one of those dots. And if I was to go back, let me just see, now that you saw that picture, see if we can catch live again. Do you see how it's kind of spraying little dots in that area? Hopefully that's made clear. So, okay, so that gives you a visual of the treatment. It's pretty easy to be the patient during one of these treatments. You're numb, you lie there, you feel a little prickly, warm sensation, and you just have to let our clinicians do their thing. After the treatment, and these are some pre and post-treatment instructions, we want everybody to understand these very important rules. So you must stay out of the sun for 2 weeks before and 2 weeks after each treatment. This is really, really important. Combining laser energy and sun on your skin can cause things like burns and blisters and scars. So super important that anybody signing up for these treatments knows that sun precautions must be taken. If you are a person who is prone to hyperpigmentation, meaning you get dark spots easily, we like to pre-treat you with a pigment suppressor. So if you decide to purchase a series of these treatments, we will make sure you get the right pigment suppressor and that you use it for a period of time. Usually it's 2 to 4 weeks prior to your treatment, depending on your skin type. We want you to stop all other medical grade skincare products a week prior to your treatment. I already talked about the possibility of mild sunburn-like redness and mild swelling for a few days, but we always remind you that at the time of booking. And then a couple other things: no sweaty exercise or excessive heat for 48 hours after your treatment, like no hot tubs, definitely no sunbathing. We already talked about that, but nothing that would like deliver heat to your skin. We want to keep your skin cool and let it heal for 48 hours. We do want you to keep your skin clean. Do not apply makeup for the rest of the day. But other than that, it's a really simple thing to go through, and you can resume all other normal activities right afterwards. So let's go through some before and after pictures. Everybody loves before and after pictures. This is a very dramatic result of a patient who got the laser treatment around the mouth, obviously. So if you have lip lines that concern you, this is a really great way to go. For deeper lines like this one, we sometimes fill this with filler, but we would also want to add Vivace to get deeper treatments. So a series of 3 combination treatments of CoolPeel and Vivace would be a wonderful treatment for a patient that looks like this in the before condition. Okay. This is a patient with acne scarring, this kind of pitted acne scarring, and it just shows a beautiful result. We would also strongly recommend the combination of CoolPeel and Vivace because acne scars are deep. Again, let me remind you that anything that is deeper in the skin should really be treated with a deep treatment. But there's also some superficial conditions on this patient as well. So the combination of superficial and deep is really the way to go. This is the chest with just a laser. No need for Vivace on this, but this is a really nice example of just removing some of the sun damage, refreshing the skin with fresh, new skin. I mean, I think that's probably one of the best things to describe about the CoolPeel is it replaces old skin with new skin on the surface. Some more pictures. So this is a before and after of somebody with sun damage, clearly. She's got a little bit of laxity here. She's got fine lines and wrinkles. She's just got an assortment of everything. And so if she just wanted to treat her sun damage, her fine lines, we would possibly just do CoolPeel. But if she really wants to get the benefits of tightening and improvement on especially the neck and jawline area, that really comes with Vivace. This patient is younger patient, just a little bit of ruddiness and sun damage, great for just the laser alone. This patient, pretty significant amount of sun damage on the left. She's got these lines. If any of you listening today have these cheek etched lines, we really like to treat with the combination of Vivace and CoolPeel. She's also got some fairly deep lines up here, some fairly deep lines around her brow. This is a fairly significant amount of sun damage. And the ideal treatment plan for a patient like this would be to do both Vivace and CoolPeel. And she could still benefit from some additional treatments, by the way, but this is after a typical series of 3. And I didn't mention that earlier, by the way, but the starting series is 3. Many patients find that they get the results they're looking for after a series of 3, but there is absolutely no reason why you can't do another series of 3 or even additional treatments beyond 3. So when we do consultations for patients, we sometimes recommend that they, for certain patients with more significant damage, we do sometimes recommend that they start with 3 and then we will assess after 3 with the goal of probably doing more treatments afterwards. And it can just be one treatment at a time after that, or it might be a whole nother series of 3. We just kind of play that by ear. This is a great CoolPeel only example, just that the little lines and wrinkles under the eyes. We do always treat the full face, by the way. This is just a focused picture of the eyes so you can see the before and after. We really don't like to treat areas of the face by themselves because you run the risk of things not looking uniform when you're done. But just to, as I said, just a close-up view of what we can do for some of these conditions like fine lines under the eyes. She's a great example of, again, a combination of things. She's got kind of a ruddy complexion on the left, which usually comes from sun damage. So she's got like discolorations and uneven texture. She's got a need definitely for some tightening in the neck and on the jawline. And so she would be a really great combination of freshening up the skin and removing some of that sun damage with CoolPeel and combining it with Vivace of both the face and neck, the whole thing, face and neck. She's even got sun damage on her neck, the kind of crepey, wrinkly skin and just aged, sun damaged looking skin. But then the tightening part comes from the Vivace. We saw this person earlier when I showed just the before pictures, but this is the after picture after treating her, especially noticeable on the neck and the jawline, the tightening that she got. And we also saw this before picture of, at the beginning, and here's her after. So she got really nice. Do you see how the quality of her skin is so much improved? She got some nice tightening and contouring on her jawline, helped tighten her neck up a bit. And generally her skin just looks refreshed. It looks fresh and new, whereas here it looks kind of dull and damaged. It's the easiest way to say it. So great example. This definitely would best be treated with a combination of CoolPeel and Vivace together. And this patient, again, this looks a little funny here. This is not airbrushed and it looks like it is, but forgive the after picture appearance. I still really like to show this picture, even though I don't love the before and after quality, because this is such a good example of a patient who would benefit from a combination of CoolPeel and Vivace. So this is a slide that goes through pricing. I know it looks a little bit complicated, but I really like to make sure we communicate the prices and how the packages work. So the top section here is CoolPeel alone. So this is the price for CoolPeel series of 3 when you do just a face. So it's $2,024.50 for a series of 3 treatments for face only. And I'm going to skip down to the bottom of the slide just to point out that all of these packages include the PRP or PRFM, that topical plasma treatment, as well as a full-sized kit of post-treatment skincare products. And it's an excellent kit of really awesome skincare that will make sure that you get the best results from your treatment. The value of the skincare included is $374.50, by the way. So that's all included in this price. If you want to add your neck to that, you would add $450 to that price, and then you get your face and neck treated at the same time. Again, series of 3, that's the total series price. And then if you wanted to add your chest to that, you could add face and chest. If you don't care about your neck, you could add face and neck and chest and just add all 3 of these up. And don't worry too much about adding this up yourself right now. I'm just trying to get everybody in the ballpark of the cost of these treatments. If you do decide that you want to purchase these things, obviously we can help you out with a quote for the areas that you're interested in over the phone and add everything up for you. So I just wanted to give you a rough idea of what these things cost. If you end up being a candidate for CoolPeel plus Vivace, you would take the prices for the area of CoolPeel above, and then you would add the price of Vivace. And these prices include 15% off the combination. So again, don't worry about adding the numbers up too much right now. I just want to tell you that if you decided to add a series of 3 Vivace treatments to the face, you would be talking about adding about $1,900 and so forth. So just to give you an idea. We do have 2 special offers right now. One of them is available to all of our patients, and we're running it through October. It's 25 units of Botox for free with any series purchase of any lasers. Actually, it's not just CoolPeel and Vivace. We have other lasers too that aren't part of this webinar today, but any laser series or Vivace series that is purchased in the month of October, you get 25 units of Botox free. That has a value of $325, by the way. And if you decide as a result of attending our seminar, we always like to reward seminar attendees with something special. We will include your hands, treating your hands for free if you decide to purchase any 2 body parts above. So, and that's true if you purchased 2 areas of CoolPeel, we would treat your hands with CoolPeel. If you purchased 2 areas of CoolPeel plus Vivace, we would treat your hands with CoolPeel plus Vivace. And that has the potential to be up to a $25.50 value. That's if you get CoolPeel and Vivace treated, your hands treated with CoolPeel and Vivace. So there's actually some very, very significant value in that free hands treatment, if that's something you decide to do. And we have extended that special to all webinar attendees through the end of this week. So take advantage of those if you think that these are some treatments that you'd like to do. Again, all packages include the PRFM, the plasma treatment, plus the skincare. And I want to mention for any of you that are members, you get additional discounts above and beyond what's stated here at the rate of 5% additional off your series, plus our members get special retail discounts. So for those of you who are not members or not familiar with our membership program, we have it's got to be one of the best deals ever. You only pay $199 for a full year, and it gives you access to a huge list of discounts and added benefits and things like that. And it's so affordable. So we can also sign you up for a membership if you're not a member at the time that you decide to make your purchase of CoolPeel and or Vivace, just to let you know. So I know there's a lot on this slide, but hopefully it gives you at least a rough idea of the general costs of these treatments. And as I said earlier, if any of you do decide to purchase and you're interested, we will absolutely walk you through, you know, the particular package price for your individual interests and needs. So that was a lot to cover. I hope it provided you with useful information. We do like to allow a couple minutes for questions. If you do have a question and you'd like to submit it, there's a little Q&A button. It's probably either at the bottom or the top of your Zoom screen. And if you click on it, you can type in a little question to us, and we can answer that right on the spot. So we usually like to give just a couple of minutes at this point in the presentation to answer any questions. And I see a couple of questions coming in right now. And I also see somebody that just raised her hand. Oh, and there's, okay. So yes, I have a couple of questions coming in. One of which was, will you put the pricing up again? So I'm gonna go ahead and put the pricing up on the screen while we answer some questions. So for those of you who wanna look at the pricing, there it is. And let me take these questions. So one question, which we get frequently, I'll start with that one. How long would these treatments last? So great question. These treatments, think of it this way, these treatments literally give you a new start. So we are removing your old damaged skin and your body is going to replace it with brand new skin. So very much how you take care of your skin post-treatment is going to determine how long your results last. We cannot state that enough. So literally best case scenario, if you were really good about not getting sun exposure, kept your face out of the sun, used great products, it is very likely that you may not need to do another one of these treatments for a very long time, like maybe years. Our average Floridian, however, I'll be honest with you, who lives in Florida for a reason and enjoys the sun and likes to go to the beach or sit by the pool or just spends time outside, eventually you probably will need a touch-up. And we do often do touch-ups maybe once a year for a lot of our patients, where you would come in, you would not need to do the whole series again, but you would just do one refresher treatment to kind of keep resetting the clock a little bit each year. So that is the most common scenario, is you do a series all at once now, and then check in with us once a year or plan to do an annual touch-up, and that really preserves results for a very long time. Let's see, so how often can I get CoolPeel treatments? The answer to that is really, you could literally get these treatments, any of these treatments, every 30 days. We do like to wait 30 days between treatments to allow for healing in between, but you could literally get one of these treatments every 30 days for the rest of your life. I mean, it just keeps regenerating new skin. So most people, as I said earlier, do really well with a series of 3, but you can do as many as you want, and you can do them every 30 days. Some other questions. I'm not sure what I need. That is a great comment. A lot of people are not sure what they need. And what I would tell you is my next slide, the very finishing slide that I'll put up here in just a moment, gives instructions for you as to what to do if you're not sure what you need. We would recommend you book a consultation. Due to COVID, we've gotten very well versed at virtual consults. So you don't even have to come into Radiance in order to get a really great, effective consultation now. We have several ways of connecting with you virtually that we can coordinate, and we can do a quick consultation, talk to you about your needs, and really help you determine a plan. We do really recommend that. I mean, unless you're really certain what you need, which is possible. Some people are much better versed in these things, but you can just call Radiance and purchase what you need over the phone. We'll ask you some questions and make sure it's the right treatment. But if you're not one of those certain people, the next step would be to book a consultation. And you can also come in person for consultations too, but a lot of people are enjoying doing the virtual consultations these days because it's just so convenient. You can do it from the comfort of your own home. Somebody else asked, am I too old? I'm 70. You are absolutely never too old to look your best. And as long as your skin heals, which it does, as long as you're alive, your skin absolutely has the ability to heal, or you would be in trouble. You can get great results from these treatments. The one thing that can vary from people of different ages is the rate at which the healing and the results develop. But we're still talking about a matter of maybe it might take a few more weeks for an older patient to heal than a younger patient. That's it. Healing time can vary, but the eventual results will be just as good. And other questions. I'm going to take one more question because it's 11:56 and I want to cover one last slide and make sure we get you all out of here on time. Let's see. Are there any side effects? The two questions I'll answer real quick. Are there any side effects and when can I wear makeup after the treatment? The side effects we pretty much just already covered, but I think it's really good to go over them again. The only side effects you should really expect are redness and maybe a little bit of mild swelling. And you can put makeup on within 48 hours. Our providers will give you some very specific instructions, but depending on the treatment, the exact treatment that you get, whether it's CoolPeel or CoolPeel plus Vivace, they will tell you it's usually don't put makeup on till the next day. We just want those little channels to be closed so you're not putting makeup into the open channels of your skin for obvious reasons. So we usually say 24 to 48 hours is a great time to keep the skin really clean and at least minimize your use of makeup. But you should not put makeup on the same day for sure. So if you're getting the treatment done and you wouldn't want to go anywhere afterwards without makeup on, you should just plan to go home. We tell people that all the time. So great questions. If you do have any other questions that we did not answer, you are welcome to submit those later. We are going to send out an email. We always send out a follow-up email to all of our webinar participants so that you know how to reach us with any additional questions you might have. We will also send out a link to our pricing. And here's the next steps for anybody who would like to take action after the webinar. Number one, if you have questions or need a consultation, you can message us now. I did make note of the individual who said that you're not sure what you need. So we will reach out to you after the webinar and see if you want to connect for a consultation or for questions. If anybody else would like to connect for a consultation or questions, you can call us after the webinar. We can quickly get you on the books even today for a virtual connection, if that suits you, or there's a lot we can accomplish just over the phone as well. So just give us a call. If you're ready to purchase, we can take care of that over the phone too. Super simple. We'll go over the details of what you want. We can take your purchase and even get you scheduled over the phone. Our bookers will ask you questions to make sure you're prepared and cover all the details. But we can do that all over the phone. If you need more time, which is totally understandable, some of you may be learning about this for the first time. As I said, we'll send out a follow-up email to you, and please feel free to ask us any questions or reach out to us when you're ready. And do keep in mind that there are some really amazing specials available right now. And if you have any interest in doing these treatments, it is laser season, by the way. And the reason it's laser season is that it's a great time to do these treatments now that it's fall and people spend less time in the sun. The summer's over and you really do have to be extra cautious in the sun. So this is our busiest time of year when everybody runs in with their summer sun damage and signs up for their series of treatments to make their skin look young and beautiful again. So do keep in mind the current specials, both free Botox and the offer to treat your hands for free. And I think that covers everything. Thank you so very much for your attention. It is noon and we're going to let you go back to your busy day. But we really appreciate you attending today, and please don't hesitate to reach out to us after the webinar if you'd like to talk to us for any reason. Okay, thank you so much, and enjoy the rest of your day. Bye-bye.